2008, Michigan voters approved a measure that legalized the use of medical marijuana. Supporters of this have been outspoken for years, saying the drug is safe. It's an alternative way to treat diseases such as MS, glaucoma, and HIV.
But a comprehensive study just released is now kind of questioning the drug. Is it really an effective method of treatment? According to a review published in the Journal of the American Medical Association, there is little reliable evidence to support the drug's use.
Now, researchers said there was, quote, moderate evidence that it helps with chronic pain and muscle spasticity related to multiple sclerosis. But there was little evidence that it can relieve nausea and vomiting related to chemotherapy, or that it even helps people with sleep disorders get more rest.
There was no reliable evidence it was useful for treating depression, anxiety, or pressure related to glaucoma.
Joining us now to discuss this, Chief Health Editor Dr. Partha Nandi. So first of all, a little surprising that, that after all these years, suddenly we start realizing maybe it's not as effective as voters thought in 2008.
Well, you know, here's the thing, though. I think that they're looking at this study looks at a bunch of other studies put together, so it's kind of the first of its kind to look at it so comprehensively. But I like it. I like the way it's going because it's finally objective evidence. It's not like, you know, I talked to Bill, he said it worked. I talked to Sally, he said it didn't. We're looking at objective evidence as docs and healthcare providers we can look at, so I like it.
23 states, Washington, D.C. allow for medical marijuana. Do you think it was rushed maybe before we had all the evidence about this?
Here's the problem, you know, it's, as a physician and as a scientist, I would say yes, but here's the thing, as a patient advocate, there's some stuff that we can't treat. Right. You have patients that are desperate, so I don't think first line, but there's some opportunity for second and third line to get some benefit. You know, when you're really suffering and nothing's working, what do you do?
Right.
And so that's why there's some opportunity there. Exactly.
Right.
Now, as you know, the FDA does not oversee medical marijuana because of the way it's structured under the laws, so it's up to the states to decide whether it's effective, whether it can be used or not used. Is this a problem with the fact that it's not going through the normal drug testing?
Yeah, it is. You know, I think that because it is a drug. So we don't approve it the way that we do other drugs. It takes years to approve other drugs, and so marijuana is not privy to that. Remember, you have to prove that a drug is safe in the normal FDA process. Then you have to try it on people like you and I and healthy volunteers, and also on people with the disease to make sure it works. It can take up to 12 years. So clearly we're not following the process that we normally do. But I think that because of the fact that people were so desperate, that's part of the reason why some of this went through.
Would it meet the test, do you think, if it went through that whole process?
I don't think so, because the trials were just the way this evidence comes out. I think it would not.
And let me ask you one more thing about I know that we found in here that 60% of products said they contained more THC than they actually did.
Right.
Could that account, do you think, for the fact that it didn't work in some cases?
It absolutely could. The problem we don't know is that we don't know if the trials use the products that they're talking about here. So, you know, you got 12 trials, let's say, and we don't know what the content of THC is. But remember, also, 23% of people had more THC than they promised. And you're eating this stuff, and so you can get lots of side effects that people don't think about.
We've got about 15 seconds. What do you got coming up at 5 o'clock?
You know, the FDA is putting a big announcement on e-shore. You got to listen and watch and see what they're talking about. Really important.
Yeah, birth control option for women.
Exactly.
Okay.
Exactly.
We'll be watching today, Dr. Nandi. Thank you very much.
All right.